During the month of Ramadan, 1.6 billion Muslims around the world fast without food or water from dawn to dusk. Though fasting is considered obligatory for those who are able, exceptions are made for health conditions, pregnancy, and other factors. But what does this mean for Muslims with mental health conditions? Conditions that are invisible to the human eye. I rallied together some community members to discuss these realities, some with lived experiences.
I was diagnosed with clinical depression and anxiety.
I suffer from bipolar illness.
A physician.
I'm a primary care physician in the United States.
And an ustadha.
I'm a teacher of Khairaan and Islamic studies.
To shed light on what it means to navigate the holy month of Ramadan with a mental health condition.
Hi. I have not fasted consistently for maybe the last 5 years, and that's because I was diagnosed with clinical depression and anxiety, and in previous times I was on medication for it, and that medication would make me have a dry mouth, incredibly hungry, nausea, sickness, incredible exhaustion, so many side effects, and I decided one year I can either push myself to fast every day, put that priority at number one, which it always was for me, but I had to think about the sake of my mental health. What would happen to my mental health if I put fasting first and didn't listen to my body and what it needs? And also understanding my body's capabilities now that I'm suffering from clinical depression. What does my body need? What can it put up with? What can it tolerate? What will be good for it? I came to realise that despite any judgment that may come, I have to be kind to myself and just fast when I feel capable of doing so.
The reason I can't fast is because I suffer from bipolar illness, and it would really badly affect me in the sense that I would become unstable and I would feel depressed, or either I would become manic. You know, I'm under therapy right now, and that helps me deal with my illness day to day. And also the medication makes a big difference in my illness. Like without medication, like I could not deal with my illness at all.
There's a slew of conditions people are on medications for, and stopping any of these medications prematurely or changing the schedule even can really affect how a patient will do. You could have a relapse of a condition, which would be associated with psychosis or uncontrolled blood pressure, uncontrolled blood sugars, especially if you're messing with the dosage. Obviously, if you're not taking the medication for your condition, you're going to have symptoms that the condition is associated with, including depression or suicidal thoughts for people who have depression or anxiety. Along with this, other things that can happen are withdrawal symptoms. Withdrawal symptoms such as nausea, vomiting, headache, dizziness, any of these, and among many, many more can happen with somebody who stops the medication abruptly without medical guidance. So it's really important to make sure that you stay on your medications, that you stay on the proper dose that you were prescribed, and take it as prescribed without messing with the dose, especially without consulting your physician. For anyone who is concerned about fasting and taking their medications and how it's going to work out, the best recommendation would be to speak to your doctor, see what they recommend, and go by that. They may be able to adjust the timings of your medication or split the dose in a certain way so that you're able to fast and take your medication at the same time. Or perhaps if they recommend not to fast, that's something that you really have to think about as well, that if it's recommended not to fast, it's probably best for you. And there are other ways to make up that missed fast.
Now, in Sharia, there are 2 points that I want to mention that will help us understand this rule. The first is one of the objectives of Sharia, from the 5 objectives of Sharia, one of them is to protect one's life, one's soul, right? And the second point that I want to mention is that we as Muslims, we believe that you should not harm others and should not be harmed. Like, should not let anybody harm you or you harm yourself. So no harm should happen in both ways, right? So that's that. So anything that will harm you, cause you harm, Islam, of course, will exempt you from it. All right? But do we decide that? No, we don't decide that. We have to consult our doctors, and the doctors have to say that, yes, by you fasting, it's going to affect you health, like physically, mentally, in any ways, and you should not fast. If you have that report or like that decision from the doctor, then by all means, you talk to your maybe sheikh or a counselor also, just to confirm that and tell him that this is what I'm going to do, and that's it. You don't have to worry about it, inshallah. Does this include those with mental health conditions? Absolutely, because anything that harms you, right, is the rule. But then again, the same thing, you consult your doctor.
In the beginning, yeah, I probably said, yeah, I'm fasting, and I wasn't, and I was, I suppose, fortunate that I wasn't caught out. But I think that's quite an interesting thing, having to lie to people in the community about fasting, because when was it ever their place to judge? When did we think it was acceptable for them to judge? When did we start worrying about other people's judgment? That's not the point of Islam to me. Community judgment doesn't come into it. So I've really tried to not let what other people think of me bother me, because if they're judging you, they're already in the wrong. There are many misconceptions that people have when you tell them that you're not fasting due to a mental health issue. It's not a broken leg, it's not a physical ailment in any way. And I can sit on camera and smile about it, as I am now. It's my coping mechanism. But people will see that and say, you're fine, you're lazy, you're not disciplined. This, to me, is ignorance. I hope it changes. I hope that mental health stigma is fought, and it's up to us as a society, as a community, to be more empathic to one another. And although we can't directly understand another person's struggles, it's up to us to try and empathise with it. I think it's really dangerous to dismiss something you don't personally understand because you haven't experienced it firsthand. I think that's something that societally we have to work on. You don't know someone else's struggles, and just because you can't see it, it doesn't mean it doesn't exist. When someone does make a judgment, it really plays on your own inadequacies. It can make you feel weak-minded, it can make you feel really guilty, really bad. It took me many years to understand that that's the problem of the other people and not me. I'm not making judgments upon them, I mind my business, and perhaps they should do the same. In terms of underlying guilt, it's between you and Allah. If you know that if you fast, your health will decline in whatever way, or it's not good for you, Allah understands, all merciful, all gracious, all forgiving. I have faith in Allah that He won't punish me for something that's beyond my control, or certainly feels like it.
I can feel it sometimes that people might judge me, or I'm lazy, or not as devout, and I feel the lack of understanding. There is such a stigma in the Muslim community. Like, for many years I wore masks, and I didn't want people to know about me, not the real me. And anyways, I just feel like if people knew, that probably, I wouldn't have as many friends as I do. That's true. Like, I don't talk about this with my friends, my Muslim friends. I don't talk about it. I would just tell them that, like, mental illness is the same like any other illness.
The beautiful thing about Islam, that you will get rewarded, okay, if you're exempted from something that you were doing when you were healthy and you were in your hometown. So let's say this one more time. Let's say, for example, someone is doing like lots of ibadat, whatever, whenever he's healthy and he is in his hometown, and then suddenly he got sick or he's traveling, he can't do the same thing, right? So he will be exempted from them, but however, he will be rewarded for that. The same thing, okay, even though he's not doing it. So that's just awesome, awesome, awesome. And one important thing also about that feeling of guilt, we should not dwell on sadness or feeling like guilt, because that's just gonna make us feel weak, right? Sadness is just makes us feel weak, and that's what shaitan wants. We should be always optimistic and positive about our life and do what we have to do just the way that Allah wants us to do it, right? This is Allah's decision. By obeying Allah's decision, you are obeying Allah subhanahu wa ta'ala. Okay? So don't feel bad about it and just embrace it and accept Allah's decree on you.
Ramadan, what does it look like for somebody who's not necessarily fasting every day or not fasting at all because they can't for whatever reason? What does it look like? It's a spiritual journey. It's a journey of kindness to one another, and really importantly to yourself, because you won't be kind to another person if you're not kind to you. You just won't be. No judgment, but I know Muslims who may pray 5 times a day and fast, but they're not working on being a better person. They're still heavy in judgment towards others. So my goal in the month of Ramadan, if I don't fast, obviously zakat, giving charity, but my goal is essentially to become a better human being. What can I offer to the world? What does the world need from me? Who can I help? How can I help them? What can I do to better myself in order to be a better daughter, a better sister, a better friend? How can I make myself a positive contribution to earth? And heavens knows we need it right now in this pandemic.
I feel that Ramadan isn't about eating, like it's about self-sacrifice, and it's about compassion for others. But you can do so many other things like prayer, reading the Quran, helping other people, like even talking to elderly people over the phone, or just being good to your family. Those are acts of worship in itself.
For anybody who's observing Ramadan without fasting due to health concerns or health issues or medications, I would have to say that you are one very brave and strong person, because there's so much pressure on people to fast during Ramadan. And we feel that we need to, ignore our health conditions and just focus on the fasting aspect of Ramadan, because there's a stigma for people who don't fast. So kudos to you for taking the medical advice and not fasting. There are so many other ways to participate. You can do zikr, you can do zakat and sadaqah, you can do namaz, you can read Quran, you can do so much more. You can help others, you can feed others, you can open others' fasts. There's so many ways to participate in Ramadan without actually fasting.
For anybody that cannot fast, for every day that he doesn't fast, he feed a poor person, like one meal. All right, that's usually they decide. I think it's about $10. That's about that. You can ask your mosque also about it, but it's about that. Okay, so it's about $10. You feed one person every day that you're not fasting, but make sure that you consult your doctor and make sure that this is like you're doing the right thing. Okay.
Advice to somebody who's observing Ramadan without fasting due to health-related issues: please be kind to yourself. Please don't let the judgment of others that may happen. Some people are still old-fashioned and narrow-minded. Don't let the judgment of others let you reflect on how you feel about yourself. You know yourself. If they have a problem with it, it's their problem. You know what's best for you. Don't sacrifice your health for the sake of a community or for a group of people who don't care enough about your health to try and understand. They're not worth it.
Just, feel proud of yourself, and, just feel that you can accomplish so much if you just take care of yourself. Don't feel bad about seeking help if you need it. And it will make you function better and do better things in your life. Like, you shouldn't feel ashamed. I guess that's what it is, shame that comes along with mental illness.
Judging is not really a good thing to do. In Islam, of course, who are we to judge? We're supposed to let everyone be judged by Allah subhanahu wa ta'ala, right? My advice to you, I understand your feelings. I understand that you love Allah subhanahu wa ta'ala. I understand that you really care about fasting and you feel like it's a big deal, right? But guess what? Allah subhanahu wa ta'ala also is the one that asks us to be exempted from it. So to be exempted, it's obeying Allah subhanahu wa ta'ala at the same time. So you have to understand, we're obeying Allah both ways. We don't follow our feelings. If we would follow our feelings, we would be in trouble. Because sometimes our feelings can mislead us. What we have to do is follow Quran and Sunnah. What Quran says to be exempted for sick people and travelers. So we do it willingly and happily to accept Allah subhanahu wa ta'ala's decision.
For those of you who judge other people, I feel that the self-righteous people somehow like wake up and they become even more self-righteous during Ramadan. And I think that that's inappropriate. Don't judge others for an invisible illness. You don't see their diabetes, you don't see their blood pressure, you don't see their depression, their anxiety. That doesn't give you the right to judge them or to label them or to, create a fuss. I think that one of the biggest lessons we learned during Ramadan is to worry about yourself. You do you do what you can do. Let others do what's best for them, and don't judge others. Let them be. They have their own, relationship with God, and so do you. And I think that if we let others live and let live, so I think it'll help create a more positive atmosphere overall.
And if it's talking about mental health stigma, at risk of being judged by people from England to Pakistan to America, then so be it. Everyone just take care. Do what you can do.
Assalamu alaikum. Peace be upon you all. Thank you so much for watching. You don't even know how much I appreciate it. If you enjoyed this video, please like, share, and subscribe below. I actually want to hear your comments. I want to see them. I want to read them. I want to enjoy them. Come on, comment below. Take care, and inshallah we'll talk soon. Peace and love.